Welcome to video 1, where we will briefly explore back pain and start discussing some ideas behind managing it. First off, it's helpful to know what back pain actually is. Put simply, back pain is a triggering of receptors around your lower back and buttocks which tells your brain these structures could be under an actual or potential threat. This could be due to a risk of tissue injury before it happens, actual tissue damage such as a muscle strain, tightness or weakness. Essentially, your brain wants something to change. Now, you can think of it as a protective mechanism which is designed to kick in and stop you from causing any real or further damage. Sometimes this protective mechanism can be overly protective and is more easily triggered, even when the risk of doing any damage is low. Examples of this would include when pain occurs during small, non-threatening tasks such as bending down to open a low cupboard, getting out of a car, or even turning in bed. Interestingly, research shows that the level of pain experienced is not always an accurate gauge of the damage that has been done. Think of catching your funny bone, stubbing your toe, or standing on a piece of Lego when barefoot. It's highly unlikely that you've caused any actual tissue damage, but it can still really hurt. Back pain is often very much like this. An increase in nerve sensitivity and hyperprotectiveness can mean that pain can persist, sometimes for weeks or even for months at a time, even after the initial danger or threat which triggered it in the first place has gone. Pain can settle but reappear later on as the nervous system deems there to be an ongoing potential threat, often when you experience similar muscle tightness or awkward positions. Pain in the short term is often useful. If you pulled a muscle, inflamed a joint, or aggravated a nerve, the pain makes the movement difficult. This gives the injured tissue an opportunity to settle down and heal itself if it needs to. If you're straining your back and it's struggling to cope in certain positions, pain can act as a warning, telling you to either stop what you are doing or change position to reduce the stress going through it. Examples of potentially stressful situations for your back include repetitive, awkward or heavy lifting, being sat, stood or stooped in the same position for too long, or sharp, unexpected increases in strain, for example, during a fall or a sudden jarring of your back. Research shows that the vast majority of back pain usually settles within 6 to 8 weeks. This is the rough time it takes soft tissue to completely heal if it needs to. However, the good news is that back pain can often resolve much sooner than this if the pain receptors are encouraged to calm down quickly. We do this by taking pain relief. Pain relief does not mask damage but reduces the sensitivity of the pain receptors, reducing muscle tension and allowing us to start to move in a more relaxed way. We should aim to find comfortable and relaxed positions throughout the day, as well as limiting the number of aggravating activities. You'll see more on this in video 3. It is also important to undertake gentle movement and low load exercises, starting lightly and increasing the load and duration as able. This will calm the pain receptors down and allow comfortable movement to be regained. For examples of these exercises, please see video 4. Occasionally, back pain can persist beyond the 6-week mark. In this scenario, pain is not necessarily indicative of damage. It is often due to hypersensitivity within the nerve structures, and this can take a little longer to calm down. At times, a person has tried to work through the pain and not allowed the receptors an opportunity to settle, which can mean that pain lasts longer than 6 weeks. Think of certain jobs that involve repetitive tasks or sustained bending or twisting of the spine. It is worth noting that there is also now a proven link between worry, anxiety, low mood, poor sleep, and high levels of ongoing low back pain. We know that these types of stress can all contribute to increase in sustained pain levels and could even be the initial trigger. Please be aware that back pain is rarely serious, despite often being very painful and debilitating, and resolves in the vast majority of people most of the time. There are plenty of things you can do to treat and overcome back pain. Please watch videos 3 and 4 for further guidance. However, it is worth being aware that in a very small number of cases, back pain can indicate a more serious problem. Please watch video 2 next, which goes into more detail regarding signs to look out for.